Might find them. There's a whole group up here in front now that the Spitalis have gone home. So anybody searching for a seat, I've got a spot for you. And you'll get ready with the panel in just a minute. I wanted to get us started on the afternoon dealing with the supportive services that people living with serious illness so often need. In preparation for this endeavor, I gathered all of the articles reporting on some effort to enhance supportive services, and I read nearly 100 articles in the professional press, mostly, a few are just online, reporting one or another thing that was successful. And what was striking about that was that if you target carefully, the country is so deficient in supportive services that everything works. I mean, could you have done this with medical care? I don't think so. There must be some places where, people actually have enough blood pressure tests or flu shots or whatever. But on social services, if you target the population, you can report something in the literature that says that it works. The problem, of course, is that essentially none of them are sustained or spread. So we may be on the threshold of getting to where they're sustained and spread. But I do feel rather like Robin this morning. I've been at this for 40 years. I first started working in long-term care 40 years ago next month. And yes, things have gotten better. There were whole states where more than half of the people were tied down every day in nursing homes. There were whole nursing homes with 30% of people having grade 3 or 4 pressure ulcers. We've come better than that. But on June 1st last year, the state of Louisiana announced that they were going to discharge 17,000 people from nursing homes on the 1st of July for lack of funds in the state budget. And that got a 2-sentence message reporting on CNN and no other attention outside of the state. Why weren't we shocked? Why weren't we outraged? So, as I'll tell you later, I'm teetering on the brink between frustration and fury. And I hope you'll be able to stay around for the last session where we'll get into action steps. But in the meantime, we have a wonderful panel for you, and I think I've got just about everybody to their seats. So I will turn this over to the next panel.
Thank you, and good afternoon, everyone. I am Peggy Maguire. I'm the president of the Cambia Health Foundation. We're the corporate foundation of Cambia Health Solutions, which is a proud member of the Roundtable. By way of background, Cambia is a family of companies dedicated to changing the way people experience healthcare. Our headquarters are in Portland, Oregon, and our mission is to make healthcare more person-focused and economically sustainable. To use Lauren Taylor's words, we're your hippy-dippy friends in the Pacific Northwest. We're spending money on Meals on Wheels, housing insecurity, and community health worker training. Palliative care is one of the strategic priorities of our company, and we've created a holistic approach across our foundation, our health plans, and our strategic technology investments because we really believe that palliative care is a microcosm of care that should be provided across the healthcare system. It really focuses on the experience of patients and families, similar to what was shared earlier about hospice. Since its inception in 2007, our foundation has made purposeful philanthropic investments totaling more than $30 million to advance the field of palliative care. We invest in emerging leaders through our Sojourn Scholar program, which is really designed to identify, cultivate, and advance the next generation of palliative care leaders. We provide mentorship in a 2-year, $180,000 grant that allows the scholars to conduct an innovative and impactful project in the field of clinical care, policy, education, or research. We have also invested in $15 million in to launch and sustain the Cambia Palliative Care Center of Excellence at the University of Washington in Seattle. The center promotes clinical excellence, research, innovation, and interdisciplinary palliative care education. Recently, we made a $4 million grant to the Dornbecker Children's Hospital Foundation to establish the Cambia Foundation Endowed Chair of Pediatric Palliative Care. So our investments in this serious illness care go wide and deep in the foundation. But then our health plans, we cover about 2 million people in the Pacific Northwest, and we offer what has been called by Fierce Payer the most comprehensive palliative care benefit program in the country. Our benefits and services support the entire spectrum of palliative care needs, from birth and even perinatal to natural completion of life. And one thing based on our last session about caregivers, I wanted to tell you we've done a couple of innovative things with caregivers. One, we provide counseling support for caregivers regardless of whether they are insured by us. So if one of our insured members has a caregiver who is not insured by us, we will provide counseling and support to their family caregiver under the insured benefit. And then we created a care, and any employer can do this, it's been incredibly easy, but we created a care employee resource group for our employees who are also family caregivers. And it's really this peer-to-peer support that they give each other and share resources. It's become one of our most popular employee resource groups because many of our employees are in that sandwich generation and caring for parents and caring for kids. And it's been a really neat thing to watch that resource group grow. And then through our Echo Health Ventures, which is a collaboration between Cambia and Blue Cross Blue Shield of North Carolina, we are investing in innovative solutions that address the issues of aging, caregiving, and coordinated care. Personally, I'm passionate about helping families prepare for moments of truth and helping people with serious illness live well. It's obvious to me that integrating social and healthcare services is critical to the equation. And so I want to thank Judy and Joanne for chairing this particular meeting and putting on just a fantastic session so far today, bringing us together for an educational and thought-provoking session. So thank you. And now I'm thrilled to introduce our panel. Their bios are listed in your program, and we have asked them to really focus on the on-the-ground experience. They bring a wealth of experience and a wide range of social supports and services through their various organizations. We've asked them to talk about financing, effectiveness, and sustainability of their programs. They will share with us the challenges they've faced in implementing and scaling and sustaining solutions. So let me introduce our panels, and I'll start with Dr. Gwendolyn Grady. Dr. Grady is board certified in internal medicine, and she has achieved additional certification in geriatric medicine. She's the chair of the National PACE Organization's Primary Care Subcommittee and is a fellow of the American College of Physicians. She currently serves as the Chief Medical Officer for PACE in Southeast Michigan. June Simmons is the president and CEO of Partners in Care, which she founded in 1997. Throughout her distinguished career, June has been instrumental in envisioning, creating, funding, and operating forward-thinking and forward-looking health and social service programs that meet the mutual needs of patients, healthcare delivery networks, and health plans. Will Kennedy, Dr. Will Kennedy is my Oregon neighbor and friend. Will is the Senior Medical Director for Advanced Illness at CARE Oregon, which really cares for the most vulnerable patients in Oregon. Will completed a fellowship in hospice and palliative medicine at the Mount Carmel Health System in Columbus, Ohio. In Oregon, he has really been a pioneer in a partnership with Central City Concern to build a dedicated inpatient palliative care unit for the homeless. Will is a true champion for ensuring that vulnerable populations have access to high-quality palliative care. Sarah Zanton is a professor and director of the Center for Innovative Care and Aging at the Johns Hopkins School of Nursing. She holds a joint appointment in the Department of Health Policy and Management at Johns Hopkins. She tests interventions to reduce health disparities among older adults. Her work focuses on ways to help adults age in place, and of course, this includes addressing the social determinants of health, specifically housing and food access. So this is an incredible panel. We're so fortunate to have you all here and to learn from you. We're going to start with Dr. Grady, and after each of the panelists have shared their experiences and perspectives, we will open it up to questions and answer, Q&A. So thank you all.